everybody can be a leader.
There's got to be somebody who inspires.
Leaders are visionary. It's somebody who you believe in, they're looking forward. And as an employee, I'd look at the leader and think, I want to follow you, and I'll do everything that I can to make sure that we realise that vision.
As a leader, you are only as good as your team is.
A good leader, I think, is someone who you aspire to be, honest and with integrity.
I work for Bradford District Care Trust. Coming from India, the big challenge was leaving the family behind. Some of the other challenge I had, my physical health. I had a stroke, then I had to recover from that. It's affected my work. So those challenges, well, I always take these challenges as positive because that actually has made me to move forward. The turning point for me to move into where I am currently is the identification or recognition of my potential by my manager when I started working on the inpatient areas. From there, I started involving with an NHS Leadership Academy Breaking Through programs. What motivates me in this country is being able to go the extra mile to help others, so that the influence, the impact I made in their life, that's motivated me to go forward.
I've always had a desire to work in healthcare, and that's probably more of a family thing really. My family comes from Pakistan, and it's a developing country, and healthcare is a scarce resource, especially for people who can't afford to access good healthcare. I qualified as an orthoptist back in 2000. The interactions on a one-to-one with the patient were fantastic. I love it, I still miss it. But I did genuinely feel that by moving into management, I'd be able to have a bigger impact on bigger numbers of people at higher level. And that's what drove me to get to this post where I currently am. The turning point for me was when I was in my managerial jobs, whichever ones they were, and was able to successfully deliver. So it's not about, oh, Saj is a nice guy. It's about Saj and he can deliver. I respect diversity, and what I tend to find is people will also respect diversity. So I suppose for me it's about being very clear from the outset what your values are, and being able to tell people what those values are and why. It is about being true to yourself, but also true to your colleagues and being open.
Lots of people helped me to get to where I am. My family, my friends, my colleagues, I'm all grateful to them. There are people who made it slightly difficult for me as well, and I'm grateful to them too, because that just made me even more determined to achieve the outcomes I'm after. I was part of a transformational leadership program run by the King's Fund, and that did help me tremendously. I began to realise that I've got the capacity and the capability through my behaviours to make a change in the system that I'm in. And I started doing that more and more positively. The way I look, the way I speak, my gender, my profession, the context I present, they all could be potential barriers, and I'm sure on some occasion it has been. But on the other hand, I think people make assumptions of everyone. I mean, I make assumptions too. What I've learned is, if you are aware or if you learn what those assumptions are commonly made about you, then you can either choose to nurture them to your benefit, or you can decide to dismantle them. In any case, I think focusing on barriers and challenges are not that progressive, so I tend to learn from them and move on.
There was always this worry about leaving frontline general practice and dipping your toes into medical management. As a medic, we want to make a difference to patient care. Now, you could do it either as a frontline clinician, as a frontline medic, or you could do it as a medical manager and a leader, helping develop policy, helping implement changes to the NHS structure. It's a hard act balancing or juggling the two and getting it right. The role which your family plays cannot and should not be underestimated. I mean, you've got to make sacrifices. You're away from home for long periods. You've got to invest a lot of your time in personal development, and you can't really fathom how much you have to invest when you are embarking on a program of this nature. You need to work on developing your strengths and minimizing your weaknesses. You have to develop networks. Above all, I think you need to have is self-belief.
I think for me, my most significant post was when I worked in East Leeds. I had a director who was also a black woman, so she was an absolutely brilliant role model in terms of her drive, her motivation, her achievement. I think I probably went through some personal challenges while progressing with my career. Part of it was the way I look, whether I wear a hijab or not, and I went to pilgrimage in 1997 and sort of decided I was going to wear my hijab. So I've always worn a hijab in my managerial role. I think when you're an Asian woman, you always have these family commitments. What's been absolutely crucial has been my husband, really, who's understood the roles that I've taken on. One thing I wish I could have done differently is spent a bit more time with the family as they were growing up. I mean, I'm very fortunate that they're a very well-balanced family. My children are, doing really well, and I'd like to think that I've contributed to that. But that's the one thing I think I would change.
I think there's something about being clear about what your values are, what the values are of the organisation. And I think one of the things I've noticed in the NHS is the importance of networks. Just kind of understanding where you can go to for support. Being a member of BME Staff Network and Bradford Black Workers Group in Kirklees was really important. I don't think because I was facing any kind of overt discrimination in the workplace, but I think because it provided, I suppose, a safe environment where you could be with other BME colleagues, we could talk about some of the challenges. I think there's something about having the self-confidence to apply for jobs. And I think when I look at some of the senior managers around me, it's not always the case I feel that they're necessarily any better than anyone else, but they've had the confidence to apply for jobs, they've had the support to actually believe in themselves and to understand what it is they need to do to be able to sell themselves effectively and get into those senior positions. So I think there's also something about not waiting for things to be handed to you.
My background in the NHS is that I qualified as a nurse in 1988. After a couple of years, I felt that I was ready for the next challenge. What I did was to apply for a ward sister post, and I had been doing some elements of the post during my normal working day, but when I applied for the post, I wasn't shortlisted. I asked for some feedback and I didn't even get any feedback. That took something out of me. It made me feel that maybe I couldn't do anything else apart from what I was currently doing. The turning point in my career was when I actually left that organisation, and I made a promise to myself that I would make more of myself and actually give more, and not be put off by the fact that some people didn't believe in my abilities. My passion and my values in terms of providing best care and also believing that I could achieve more and deliver more helped me through.
I've been an executive in this organisation now for over 5 years. I came from a single parent household. I think my life was very much about being with the guys. So I left school with 1 CSE and decided that I was going to go at that point into industry, and I got a job working in a factory, and after 6 weeks decided that that wasn't for me. I came out of that. My mother said to me, well, you get on well with people, why don't you go into nursing? I qualified as a nurse, and after a year working on the wards, I decided that that wasn't for me. So I went off and went to university and trained to be a social worker. One of the things I'd always say to anybody who's inspiring in whatever you want to do, if you want to go up the ladder or sideways, become qualified. Get yourself a qualification if you can, and that's the best thing. You stand on the level with everybody else then. I never forget when I got my first director's job, and and that being something that fills me with pride, that I could compete with a number of other people and get that job and feel very proud and positive, not just for myself, but for my whole community. And I never forget going to church that weekend and the church just applauding for me, and it brought a real emotional tinge for me, because they really saw themselves, some of them, the mothers saw their sons or daughters or whatever progressing to a place where we'd not had people before, and that was very powerful, and that keeps me going. I say to black people, I say to black groups when I go and speak to them, that we've got to be in positions of power. We've got to be on boards, because if we're not, The voices we make, it may be individual, like individual cases, but they're not about the direction. I want to influence the direction at a senior level, not only within this organisation, but across the country as well. Because I believe if you improve services to black people, to people from a minority group, you improve them for everybody. And I want to see good quality services.
If someone's got the desire to achieve, it's just a matter of time. It's technical afterwards. But your desire needs to be really strong.
You've got to put yourself in this position of wanting to learn, wanting to go out and meet people.
Find somebody who will support you, so whether that be a coach or a mentor.
It's never too late. I could have written off my career at the time I got my GCSEs or A-level results because they were mediocre. But do you know what? I got a passion for achieving, and if I've managed to do that, then actually I think quite a lot of people out there can manage to do that as well.
Everybody can be a leader. If you have the determination, the motivation, perseverance, then you can be a leader. I came from India, a totally different place, totally different culture, totally different language, and I had many challenges, my personal problems, physical problems. But if you have the perseverance and motivations, and you can make the changes, not only within your life, but with others' life, that's a leader.